So let me just double check that we're recording. Yes, we are. Okay. So I will talk about Philadelphia's climate hazards and how those map out to different health risks. And then I'll talk a little bit about some of the work that we do in planning and community engagement. So first, just some basics regarding climate change and health. Climate change is a public health emergency, just like COVID-19. It's a lot more slow moving than COVID-19. But however, we are already seeing its effects. It also increases the risks of public health emergency that our program has historically planned for and responded to, like extreme heat events and coastal storms like hurricanes. Climate change will also disproportionately impact people who are already vulnerable to public health emergencies. So that includes people with chronic medical conditions, the very old and the very young, people living in substandard or with unstable housing, and people with access and functional needs. So this is really an equity issue. Climate change will introduce new problems to new areas and new groups of people. So it's, really a dynamic challenge that we're trying to take on. But lastly, individuals, communities, and organizations can take steps to facilitate some adaptive capacity and try to lessen the impacts that we might see in the future. So one of these agencies is the Centers for Disease Control and Prevention, or the CDC. This is their BRACE framework. So we have adopted this in much of our climate and health planning efforts. BRACE stands for Building Resilience Against Climate Effects. And it's essentially just a system for how local health departments can start adapting to these issues. So the first step is to forecast the climate impacts for your local jurisdiction and assess the vulnerabilities that are related to that. The second step is to project disease burdens, so to see how diseases might change, how it might increase, how it might decrease, and quantify that if that is possible, because that can help a lot with planning. The third step is to assess public health interventions, so what can we do to make this a little bit better? Fourth step is to develop and implement a climate and health adaptation plan, which is something that we are working on. And then the last step, of course, is to evaluate all of this, see how we did, and see whether we are actually mitigating these impacts. So this slide just illustrates that climate change impacts a very wide range of health outcomes. So in the center, the circle that is moving are our climate change impacts, so including rising temperatures, more extreme weather, rising sea levels, and increasing carbon dioxide. The next level beyond that is kind of the environmental health exposures. So for example, extreme heat, air pollution, water quality. And then beyond that, we have these subsequent health outcomes that can result from these changes in climate and these changes in environmental exposures. So that was just kind of a really wide overview of climate change and health and some of the potential impacts we could see. I'm going to get into what's specific for Philadelphia now. So as a major metropolitan area in the Northeast, we are prone to a number of climate impacts, which I'm sure your group is aware of. Generally, the city is projected to get both hotter and wetter due to climate change. And that'll be kind of made worse by a number of infrastructural conditions and demographic and socioeconomic conditions. For example, urban areas like Philadelphia experience higher temperatures than their suburban and rural surroundings. This is known as the urban heat island effect. And it occurs because of cities' building density, industrial activities, high concentrations of dark surfaces that absorb and retain heat, and of course, high populations. Cities also tend to have limited vegetation and tree cover, which can exert cooling effects. Heat exposure also varies widely within the city. Analysis of surface temperatures by census block show that some of the hottest blocks in the city can be up to 22 degrees hotter than the coolest blocks. So again, just bringing in that this is an issue of equity. And I'll discuss this a little bit more later in my presentation. So the northeastern United States is also projected to receive some of the largest increases in heavy downpours due to climate change. Again, in Philadelphia, this could be made worse by some of our infrastructural conditions, given that the city's historical and kind of natural buffers, its network of streams and creeks were either filled in or turned into sewers. You know, of course, in the 18th and 19th centuries, this was a really innovative approach to water and sewage management, which also helps stem the spread of infectious diseases. But of course, they did not predict climate change, and the system now contributes to overland flooding, sinkholes, basement backups, and things like that. So while not a coastal city like New York or Miami, Philadelphia is still prone to coastal effects, including hurricanes and sea level rise. Excuse me. So the amount of sea level rise that will occur is of course dependent on how successful we are globally with climate mitigation, but it roughly translates to about 2 feet of sea level rise by mid-century under a lower emission scenario, and up to 6 feet of sea level rise by end of century under a higher emission scenario. So as you can see from this map that was created with data from NOAA, under almost all scenarios, this puts the Philadelphia International Airport, the Navy Yard, and large parts of Southwest Philadelphia at risk. Lastly, higher, more stagnant temperatures will increase production of ozone and decrease the ambient air quality in the city. At present, Philadelphia is already the Allergy and Asthma Foundation's 4th most challenging place to live with asthma due to both air pollution and poverty, and nearly 1 in 4 kids in Philadelphia has asthma. So this is something we're already dealing with that could be getting worse due to climate change in the future. So our team has been working on some pretty extensive research and literature review and assessment of Philadelphia's projected climate effects, which I just described. And after that research, we developed these 4 climate health risks that we believe will be the most impactful to all Philadelphians. So these include the impacts of extreme heat, the impacts of severe storms and flooding, increased transmission of infectious diseases due to changing vector ecology and increased average temperature, and decreased air quality due to both ambient air pollution and changing pollen seasons and allergenicity. So we use these 4 climate health risks to frame a lot of our adaptation planning, including developing adaptation strategies that address community engagement, research, data analysis, emergency response, heat island mitigation, all other kinds of stuff. Organizing our planning in this way also helps us map out the expected health impacts and the populations that we think will be affected. So this slide just shows some of the health impacts of extreme heat events. An extreme heat event we define as a multiple number of days in a row with higher than average temperature for a given area. And I'll talk a little bit about how we define that later in my presentation. Extreme heat is actually the deadliest climate hazard and the deadliest natural hazard in the US and in the state of Pennsylvania. Hurricanes and coastal storms and tornadoes get a lot of press because they cause a lot of physical damage that you can see, and for good reason. You know, that stuff is not nothing, but he's kind of like the silent killer. It actually causes more death, especially among our vulnerable populations. People who are more at risk to the impacts of extreme heat event include people who are more likely to be exposed to extreme heat. So people who work outside, people who are experiencing homelessness, athletes, and people without access to good air conditioning in their homes. There are also some people who have biological vulnerabilities to extreme heat. So that includes people with chronic health conditions, older adults, and younger adults. Those people, their bodies just aren't built well enough to regulate temperatures normally. And then the third item that could increase your risk for extreme heat is not having great social networks. So some of you may be familiar with the heat wave that occurred in Chicago in 1995. And while most of the people who passed away due to that heat wave were older adults, who had that biological vulnerability, the actually most significant risk factor was living alone. So people who maybe didn't know to call for help, didn't know that they were getting sick. Those were the most vulnerable folks in that event. So on the left, we have some symptoms of heat-related illness. That includes heat cramps, heat exhaustion, and heat stroke. Heat stroke is a medical emergency. When we do trainings out in communities, we train people on the different symptoms and what to do, how to recognize heat stroke and help somebody with that. In addition to heat-related illness, as I mentioned, there is heat-related mortality. Luckily, we have not seen too much of this in the city in recent years. I don't know if that's due to some of our response strategies or due to wider access to air conditioning, but it has gone down in the last few years. And then we also have disease exacerbation. So it can make things like cardiovascular disease or asthma worse. I mentioned earlier that heat vulnerability varies widely within the city of Philadelphia. So one of my colleagues, Jason Hammer at the health department, developed a heat vulnerability index for the city. And this summarizes the most important factors that are associated with health impacts of extreme heat events to help us identify geographic areas that are more at risk. Some of these vulnerability factors are sociodemographic. So as I mentioned earlier, people of older age, or maybe people who are low income, who might not have access to air conditioning, health status, so that's people with chronic health conditions, environmental exposures, so that could be related to air quality or other infrastructural conditions, like do you live on a tree-lined block, or is it mostly blacktop near where you live? So as you can see, heat exposure varies widely throughout the city, with the more affluent green areas being less hot than others. So in addition to exposure, this heat index incorporates a number of sociodemographic and health factors that describe sensitivity to extreme heat, which I just talked about. We chose these factors through a literature review and interviewing key stakeholders. And the resulting index was then overlaid with the exposure data. The exposure data was provided to us by Dr. David Handula of Arizona State University. And the exposure data is basically the surface temperature of these different census blocks. So after identifying priority areas, which are the ones that are highlighted in red, yellow, and green on the map, results show that our most vulnerable areas are in parts of Northwest and South Philly. From a planning perspective, identifying these priority areas is important because it allows us to see folks who are in greatest need for mitigation or which community organizations might benefit most from our outreach and support during the summer months. So it's a good way to kind of direct our resources. Some of you may have heard of the Beat the Heat pilot program that the Office of Sustainability ran in conjunction with the Hunting Park community. They actually used this map to choose the community to pilot that project with. So as you can see, Hunting Park is right in the middle of those red areas in Philadelphia that are highlighted on the map. Okay, so that's heat. I'm going to move on to the impacts of severe storms and flooding. So this flow chart just shows the different environmental impacts that severe storms can have. So all the way on the left, we have flooding, and the health impacts that result from that can include drowning, respiratory infections, skin infections. So if you go into dirty water, maybe with an open wound, you can get a skin infection. Flooding can also increase waterborne diseases and vector-borne diseases. Some of you may know that mosquitoes actually breed and multiply in standing water. So while initial floods might wash away those populations, once the flood water recedes, especially in urban areas, you're left with a lot of standing water, which can increase the mosquito population. And then there's also release of chemicals. So a lot of you may remember in 2017 during Hurricane Harvey, the petrochemical industry down in Houston was very much impacted by the crazy flooding that they had there. And it resulted in a number of Superfund sites releasing chemicals into communities and waterways. So if you move to the right, the next impact is displacement, which can lead to injury or infectious diseases. People have to go to shelters. It can also disrupt healthcare if people rely on regular medications, or if maybe they have a electricity-powered medical device that they use in their home. And of course, there have been shown to be a number of mental health impacts associated with losing one's home or having to leave one's home very suddenly. Ranging from post-traumatic stress to longer-term depression. The next item is structural damage. So that's structural damage to your home. Again, that could lead to injuries. It could also lead to allergies and respiratory conditions from mold and moisture. So mold has definitely been shown to increase in homes following severe storm events. It doesn't even have to be a crazy coastal storm. It could just be, a heavy rain event. Mold, of course, grows in the presence of moisture. It can cause allergies. It can exacerbate asthma. For folks who are immunocompromised, it can even cause bacterial infections. So that is definitely something we're concerned about. Given the old housing stock in Philadelphia, this is something that folks deal with all the time. On a recent weekend, I actually discovered mold in my own closet and had a really awesome end to my Sunday night cleaning that. So this is another really big point of education for us, teaching folks how to identify mold, how to prevent it, and how to remediate it if need be. And then the last item here, severe storms can, of course, cause power outages, whether that's due to flooding or tree damage. Power outages can lead to mortality, especially when they disrupt cooling systems. It can spoil food and medicine, leading to diarrheal disease. Again, it can disrupt healthcare or electricity-powered medical devices that folks rely on. It can cause heat or cold-related illness, if cooling or heating systems are affected. And then we've also seen some increases in carbon monoxide poisonings during power outages. Even in Philadelphia, we had a winter storm in 2018, and the Poison Control Center alerted us to an increased number of calls with this because folks may use generators to power their homes, and they use them improperly, and that can lead to release of carbon monoxide gas. Or folks might use a stove to heat their home if they don't have heating. So that's just severe storms. That was a lot. And again, that's just one health impact. So like I mentioned before, this is really a dynamic issue and a lot of things to think about. So our third climate and health risk is increased transmission of infectious diseases. So this could include mosquito and tick-borne diseases. A lot of vectors like mosquitoes are affected by temperature and precipitation. So significant changes in the climate could change their ecology and where they live. Climate change could lead to changes in their seasonal cycles and their spatial distribution of some vector-borne diseases, or even expand their ranges. However, it is important to note that climate is only one of many drivers of vector-borne disease distribution. So we're not totally sure how this is going to affect Philadelphia, just because it's a lot more complicated than just climate. However, a lot of mosquito-borne disease vectors thrive in urban environments. That includes the Aedes genus of mosquito, which I've included on this slide for you all to see, looking lovely on that person's skin. And that is the mosquito that causes Zika, dengue fever, yellow fever. In Philadelphia, I think right now our two biggest mosquito and tick-borne diseases are West Nile virus and Lyme disease. We had a pretty big West Nile virus year in 2018. Of course, it's impossible to say whether that was caused by climate or heat or precipitation or anything like that. But we did use a communication tool for the first time in 2018 to alert folks by text about West Nile virus and how they may prevent it. So that's something we might continue to do in the future. Climate change can also affect waterborne disease in Philadelphia. Number one, rainfall acutely increases microbial contamination. Increased temperature, humidity, and rainfall are also shown to be associated with increased legionellosis. Legionnaire's disease is a respiratory disease that is caused by a bacteria that can live in cooling systems. So when it stays hotter longer, people are using their air conditioning and building cooling systems longer. And then, of course, we have new and emerging infections, so stuff that never existed before. Zika is an example of that. And lastly, we have decreased air quality. So as I mentioned earlier, this includes both ambient air quality and allergens. For ambient air quality, we're really most concerned with ground level ozone with climate change. So ozone is produced on hot, sunny days from a combination of different gases in the air, including nitrogen oxides and volatile organic compounds. Ozone production is dependent on temperature and the presence of sunlight, with higher temperatures and stagnant days leading to increased production. So the more days like that we have, the more ozone we might have in our atmosphere. Exposure to ozone causes a number of health impacts, mostly to the respiratory tract, including inflammation. We've seen increased emergency department visits and hospitalizations for asthma associated with ozone, and even new onset of asthma. Regarding allergens, we already talked a little bit about mold, but pollen levels have also been increasing due to climate change. So that's due to increased carbon dioxide in the air, which of course makes plants grow, as well as extended season lengths. So for example, the ragweed season has been expanding since, I want to say, the 1990s. This could cause exacerbations of allergic rhinitis and asthma. And greater exposure to pollen could also mean that more people develop allergic disorders. And then I just wanted to make a note about the Philadelphia Air Quality Survey. This is something that is run by the health department's air management services. So unfortunately, that's not me, and I don't have too much information about that right now, but that is in production, and hopefully from that we will have more granular information about where air quality is bad in the city. So we can maybe do some planning similar to the heat vulnerability index to see where our at-risk populations are. Okay, so those are our climate and health risks that we project for the city. Quickly, since I know we want to have some time for discussion, I'll just go into some of our planning and outreach activities. So in 2017, PDPH developed new extreme heat activation levels to be more health focused and reflect local health data. For this, we used the National Weather Service alert levels. So, you know, those are your heat watches and heat warnings that you see on the Weather Channel. But while we looked at emergency department visits for extreme heat, we saw that they didn't really match up with those alert levels. So to make sure that we were activating services when we most needed them, we developed new alert levels, which is what you see on the screen here. So our heat caution and our heat health emergencies. We developed this approach for really two reasons. One, it makes extreme heat response health focused, and it makes sure that the days when we tell people it's really hot outside are the days when their health is actually at risk, according to our data, about 10 years of it. And number two, it addresses the problem of kind of oversaturation of information where folks might be hearing about heat waves, heat warnings, heat watches, etc., all on the news throughout the summer, which can sometimes, dilute the importance and immediacy of these notifications we issue. As I mentioned, heat is a real health risk. It causes the most deaths in the United States as far as natural hazards go. So we want to make sure that people know when it's really hot outside that it is a heat health emergency and they should take actions to keep themselves and their neighbors safe. These are some of the things that the city does when we declare these responses. So during a heat health emergency, we notify our response agencies. The Philadelphia Corporation for Aging activates their heat line. They, of course, always have an amazing helpline service, which anyone can call at any time. But the difference here is that we have PDPH nurses also answer calls, so they can talk to folks about any health issues that they are experiencing during the extreme heat event. And if needed, we may actually deploy a team of folks to somebody's home to assess their environment and their health and make sure that they're okay. In normal times, we also activate cooling centers. Those are our free library locations, so they stay open later during a heat health emergency to give people more access to cooling. Of course, we do outreach to people who are homeless and activate the code red. And PICO suspends utility shutoffs for residential non-payment so people can continue to use their AC and fans. This is just an example of the heat health emergency that we declared last year. Hopefully some of you remember. It was 6 days with a heat index of basically over 100 degrees or about 100 degrees from July 17th to the 22nd. During that time, we received almost 670 calls to the heat line, 2,800 visitors to our cooling centers, and we had 42 ED visits for heat-related illness. We also activate a lot of public information. So these are just some articles that were written about extreme heat last summer. We also work with the mayor's office to put a lot of this stuff out, and kind of a fun fact is that the extreme heat blog that the mayor's office put out last year was their most clicked on one in history. I'm sure that has changed due to COVID and all the attention with that, but we thought that was pretty cool that the thing that people clicked on most was about extreme heat and health. As mentioned earlier, we also coordinate a climate and change and health advisory group. So this is a collaborative of government, healthcare, and community-based partners that advise us on a number of climate-related initiatives, including identifying health impacts in at-risk populations, developing adaptation strategies, and sharing community engagement strategies. We are working on a climate and health adaptation plan, so that draft is in development and it is intended to complement work by other city agencies, like our Office of Sustainability. We focus on adaptation strategies to improve health outcomes. Specifically, some other adaptation plans, might be about adapting to the more physical impacts of climate. Ours is specifically about health outcomes, and we organize it by those climate health risks we went over a little bit earlier. And I think this is my last slide. I just wanted to give a shout out to these climate health and home workshops that we have put on for the last 3 years. So we held 12 workshops for over 300 residents since 2017, where we talked to community members about how climate change impacts their health and their homes and about how those things connect. We collect data during those workshops so we can kind of see how well we're doing. And I really like this statistic, just because you see that only 40% of our participants felt that they could explain what climate change is, but about 75% have reported experiencing impacts of climate change. And I think that just shows how important it is for folks like me to bring this stuff down to the local level. Climate change can be really abstract. It might seem too global and wide-ranging or far away, but I think, if you talk to folks about how it impacts something, as sensitive as their health, it's a better way to communicate that message. And we worked with a lot of partners to put on these workshops, including Drexel University, the National Nurse-Led Care Consortium, the Energy Coordinating Agency, who contributed a lot of stuff about homes and energy and how to get your homes climate ready, the Clean Air Council, and us. And just wanted to acknowledge Jessica Comm and Jason Hammer for a lot of their work given climate change, and a lot of their work also went into this presentation, and then Allie Kenner at Drexel University, who was kind of spearheaded the climate health and home workshops I just talked about. Okay, so that was a lot, and I probably talked for too long, but I'm happy to take questions or participate in the discussion, and then that's my email and phone number if anybody wants to reach out.